Hi, my name is Janet Gorman. I'm a director of nursing at Boston Medical Center. A few years ago, I was approached by Eugene Litvak to look at the throughput time of my unit. At the time, I was the nurse manager of a 27-bed unit, which housed a 10-bed step-down unit in it. And as the nurse manager, I was responsible for staffing the unit. I had to staff to the peaks of the unit, and on certain days I had an influx of volume up to 9 patients on days of the week that there was a large amount of surgery being done, vascular surgery, thoracic surgery, and cardiothoracic surgery. So on Tuesday, Wednesdays, and Thursday, when they would book large amounts of cases, I would have a large swing in volume in those days, and I had to allow a staff for those peaks. And I also had to staff for the lows. I had to predict the days that were low, but it was hard to predict those days too, so staffing was very challenging. And I had staff that didn't want to work on those days of the week with the high peak because the acuity was so high and it was a difficult day. So when he asked me if I wanted to look at my throughput time, I welcomed the idea. We worked on a lot of different initiatives to smooth out the OR scheduling, and the end result is that we did the same amount of surgery, but we spread them out in a 5-day period of time, so that those peaks that I used to have no longer existed, and I had an average swing of about 5. So the days that I was getting 1, and then the days I was getting 9, the average amount I was getting about 4 or 5 patients a day into the step-down unit, which really helps with the variability, and it helped with patient satisfaction and staffing overall.